Hi, my name is Carly, and I'm an occupational therapy student at the University of Alabama at Birmingham. And in this module, I'll be discussing sensory processing related to mealtime, feeding, eating, and oral motor skills, and then how a history of trauma may impact this relationship. Sensory processing is the ability to register and organize sensory information from the environment and then adapt our behaviors and responses accordingly. Feeding is often challenging because the sensory properties of food is constantly changing from one presentation to the next, such as during chewing and then during swallowing. Food and meals are even deeply rooted in our cultural identities, traditions, and societal norms. In addition, food is often a source of comfort, providing familiarity and a sense of security. Many of us have experienced the soothing effect of a favorite dish, either during difficult times or just during the holidays. However, trauma can disrupt a child's relationship with food, leading to maybe aversions, anxieties, and then challenges associated with eating in mealtime. For many children in foster care, mealtime experiences may be vastly different from what is considered typical. These children often carry a history of early life adversities, neglect, inconsistent caregiving, all of which can significantly impact the relationship with food and their feeding behaviors. So it's important to approach mealtimes with sensitivity and openness to create an environment where your child feels safe and that they can express their emotions and feelings and worries related to food. Mealtime is a complex process that goes way beyond just putting food on the table and eating it. Eating is the most sensory involved practice that we engage in. It involves sensory experiences in all areas, including positioning and how we perceive our body in space, smelling the food, tasting the food, seeing the food, hearing it inside and outside of our mouths, and that interoceptive awareness of feeling hunger and feeling fullness. Occupational therapists differentiate between the skills of feeding and eating. Feeding is the setting up, arranging, and bringing food to the mouth through manipulating utensils, pouring, and scooping or cutting food. Whereas eating refers to keeping and manipulating food or fluid in the mouth and swallowing it. Children who have impaired oral motor skills and sensory sensitivities may have difficulty with one or both of these. Feeding and eating also require gross, fine, and oral motor skills. Gross motor skills allow us to sit, maintain our posture, position ourselves at the table, and then feel comfortable and stable in our seat. And it enables us to reach for utensils, pick up a spoon, or bring a cup to our lips. Fine motor skills involve the precise and controlled movements of our hands and fingers. These skills allow us to manipulate utensils, grasp small food items, and engage in activities like cutting or scooping. And then oral motor skills involve the coordination of various muscles in our mouth, including the tongue, the jaw, lips, and cheek. And it's important for chewing, swallowing, and managing mood in the mouth safely and efficiently. Children may experience delays in feeding for many reasons, including but not limited to overall weakness, gross or fine motor delays, cognitive delays, behavioral refusal, or delayed oral motor skills. Feeding delays may also be caused by underlying medical conditions such as impairments in structure or function of the GI, cardiorespiratory, and neurological systems, as well as neurodevelopmental disorders such as autism, ADHD, cerebral palsy, things like that. Feeding difficulties are not unique to children in care, and it can be a result of being born premature, having poor prenatal growth, congenital heart or lung defects, or having anatomical abnormalities such as cleft palate, reflux, or GI issues, and can even occur due to exposure to drugs or alcohol in utero. The environment also impacts feeding, and it can lead to or worsen feeding difficulties. For example, how the child was cared for, such as having an unsupportive or unstimulating caregivers, having lack of nutrition or poor quality of food can all affect feeding development. In addition, any adverse or limited feeding experiences can impair feeding skills. Children in care often face additional hurdles that can add upon feeding difficulties, such as having a lack of exposure to various foods, a lack of proper nutrition, or limited or lack of introduction to solid foods at an appropriate age. All of these can hinder the development of oral motor skills, which is necessary for chewing, swallowing, and then managing food comfortably. All of these can lead to a fear of new foods or a fear of food experiences. As caregivers, you are the primary providers of food for your children, and you play an important role in shaping your child's attitudes, behaviors, and relationships with food. This influence goes beyond just providing meals. It encompasses modeling eating behaviors, regulating nutritional intake, and establishing and nurturing mealtime routine and environment. However, children in foster care often have disorganized attachments, which impact eating behaviors. For example, a child who has experienced neglect may struggle with trusting caregivers to consistently provide food. This lack of trust can result in irregular eating patterns or an unhealthy fixation on food. In addition, children often observe and imitate their parents' attitudes towards food, portion sizes, and dietary preferences. A child with a history of trauma or inappropriate modeling from a caregiver may mimic unhealthy patterns that they've witnessed, such as emotional eating or rigid dietary restrictions. Regulating nutritional intake involves ensuring that a child receives a balanced diet with adequate vitamins, minerals, and other essential nutrients in order to grow and be healthy. A child who has experienced food scarcity may develop a fear of not having enough food, leading to either overeating or hoarding food, which I'll talk more about in the following module. In addition, a child who has experienced emotional abuse during meals may associate mealtimes with fear or anxiety, which can affect their ability to enjoy and engage positively with food. Poor nutrition can also stem from rigid diets, maladaptive behaviors, and medical concerns such as reflux or constipation. The goal of this module is to help caregivers of children with histories of trauma understand how trauma can impact nutrition, sensory processing, and oral motor skills, as well as gain understanding of strategies to support mealtime success. Here are some signs your child might have some sensory and oral motor difficulties. If you notice your child displays one or more of these signs, I recommend you seek professional help, such as a specialist in feeding, to ensure timely intervention and support. Some of these signs can be either consistent poor eating, such as struggling to eat a variety of foods from different food groups, or refusing entire food groups or textures. It could be difficulty swallowing or ongoing choking, gagging, or coughing. Gagging is a protective reflex, and it isn't always negative. However, it can be a signal of a problem if your child is older than 15 months and it's gagging consistently. If your child is taking excessively long to eat, such as take meals lasting longer than 30 to 45 minutes, this can be due to a difficulty with chewing, swallowing, or just refusal to eat. If your child fatigues when eating and requires frequent breaks or eats very small portions, if your child has difficulty transitioning to solid foods and they prefer purees or liquids, if they have difficulty eating in different environments or with different people, such as eating in a restaurant or eating in the school cafeteria, and if your child has frequent mealtime tantrums or behavioral issues. Sometimes behavioral issues are a form of communication that the child is struggling to complete the task. So there may be an underlying physical skill, sensory, or anxiety issue. If your child has failure to thrive or weight loss, failure to thrive is a formal diagnosis, and it's commonly used for any child who fails to gain weight or height accordingly to the standard medical growth charts. And it occurs when a child is either not receiving adequate calories or is unable to properly use the calories that they're given, resulting in failure to grow or gain weight over a period of time. In addition, if your child has food aversions or fears of food, such as fear of different color foods, textures, or smells, if they have sensory sensitivities, so they overreact or have an aversion to some of those aspects of food, such as colors, textures like crunchy or wet, hot or cold, things like that. Lastly, feeding difficulties often result in family stress and can disrupt your routine. Occupational therapists can help provide strategies for reducing stress and improving mealtime participation. In this module, I'll provide some general strategies, but if your child displays any of these signs or if you have any concerns, I would advise you to go to your child's physician or feeding specialist to help target your child's specific needs. Children in foster care are at an increased risk of experiencing malnutrition, nutritional issues, deficiencies, all due to a combination of factors related to their past experiences, maybe social economic factors, potential trauma, inconsistent access to nutritious foods, and maybe limited access to healthcare. Adopted children or children in foster care are at higher risk of anemia, iron deficiency, zinc deficiency, and vitamin A and D insufficiency, as well as insufficient macronutrient consumption from protein and specific fats. These are all super important for both brain and behavior development. Iron deficiency can result from a diet lacking in iron-rich foods like beef, spinach, pumpkin, beans. Insufficient iron intake can lead to anemia, fatigue, weakness, impaired or difficulty thinking, and can also lead to nightmares or frequent night terrors. Zinc deficiency may occur in a diet lacking meat, dairy, nuts, and can lead to impaired growth and impaired immune functioning. Vitamin A deficiency can occur due to a diet lacking in eggs, milk, butter, pumpkin, or other dark green, orange, or yellow fruits and vegetables. And it can lead to vision difficulties, decreased immunity, dry skin, hair, and eyes. Vitamin D deficiency can occur to a diet lacking in egg, milk, yogurt, cheese, fish, and can be a factor for poor growth and dental problems. A lack of adequate protein sources such as meat, dairy, eggs can result in poor growth, muscle wasting, and weakened immune system. If you have any concerns, I recommend you visit your primary care practitioner to assess nutritional status so steps can be taken to improve your child's overall health and ensure adequate development. It's also important to visit a primary care practitioner to rule out any GI disorders or food allergies, which can cause like increased irritability, food refusal, limited variety of foods, mealtime tantrums, or discontinuing eating foods that they used to like. A general rule is to provide something to eat and drink every 2 to 3 hours a day. This will give your child about 3 meals and about 2 to 3 snacks a day. Do not allow your child to graze. If your child snacks often throughout the day, this decreases the opportunity for your child to feel hunger, which will decrease the motivation to eat at mealtime. For each meal and snack, provide at least one protein, such as eggs, nut butter, chicken, yogurt, beef, cheese, as well as providing one starch, such as potatoes, bread, rice, cereal, and then provide at least one fruit or vegetable. If your child gets overwhelmed by the food visually, provide only 3 foods at a time and offer multiple servings. It's important your child is getting enough protein, fiber, and water in order to feel full longer, which can prevent overeating. Fiber is important for slowing down digestion, and it helps you feel full for longer. These foods typically require more chewing, which slows down eating and allows our body to process getting full. Examples of foods high in fiber include apples, carrots, berries, broccoli or cauliflower, as well as 100% whole wheat crackers, whole wheat brown rice, and oats. This chart is a quick reference for portion sizes per age, but it doesn't take into consideration weight and activity level. If you want more specific guidelines, I recommend checking out these resources over here, which are all great resources to figure out how much food of each food group your child should be getting, as well as other nutritional information. My Plate is a great one, and it helps you create a personalized plan, which takes in consideration age, weight, and activity level. Be mindful that what you are eating impacts what your child is eating. It's important that children with histories of trauma are provided nutritious foods to meet both their emotional and physical needs. I know that sometimes it's easier to hand over a bag of chips or cookies, but as a family, it may be a good idea to limit intake of high-fat and low-nutrient foods and increase intake of whole foods and vegetables. It's important for children who had limited access to foods to learn and like what healthy foods, such as fruits and vegetables, they need through positive repeated exposure. Eating more nutrient-dense foods for snacks and during meals can help support making healthy choices across the lifespan. Here are some examples of some higher nutrient-dense foods that you can make the swap for snack time. You can do banana and apples with peanut butter or any other type of nut butter, a yogurt parfait, cucumber, celery, or carrots with hummus, applesauce, fruit cups, and canned fruit without added sugar, air pop popcorn, or whole grain chips and pretzels with cheese. I'm not saying that you can't provide chips and cookies. In fact, it's important not to overly restrict these, as it can lead to overeating and indulging in these later. Instead, I recommend having a mindset that there are no good foods and no bad foods, but foods that are more nutrient dense than others. Nutrient dense foods help you feel full for longer, but it's okay to consume non-nutrient dense foods, for example, cookies, chips, and sodas. The important thing is, though, is that you need to teach your child how to incorporate these foods in a balanced and healthy way. So instead of restricting these entirely, I recommend either offering a serving of chips and fries at mealtime, offering a dessert at each person's plate, and let them eat before they eat their dinner, during their dinner, or after their dinner, whenever they choose, but they don't get a second serving. Also offer everyone dessert on the weekends, regardless if they eat their meal or not. Sweet foods often suppress appetite more rapidly than other foods, so preferably offer these sweets at different times, such as for bedtime snack. So some general mealtime strategies include sitting down together for family meals. A consistent and supportive mealtime routine can provide a sense of security and belonging and will help your child feel included. These moments of shared time together create a supportive environment where children can develop healthy eating habits, learn about proper nutrition, and establish positive social interactions. However, the family table is often challenging for adopted children or children in foster care. When conflicts dominate mealtime interactions, such as issues related to food, weight, and eating habits, trust and bonding can be compromised, which makes it more challenging for children to establish healthy eating patterns. It's also important to develop a consistent routine for mealtime, such as sitting at the same table in the same spot with the same utensils. Limit meals to no more than 30 minutes and do not allow your child to walk around or wander during meals, but instead have a consistent seated location, such as in a high chair or a specific spot at the table. Wandering and grazing, which is eating small snacks on demand throughout the day while roaming, can be distracting and can impact hunger and fullness cues, nutritional intake, and can hinder positive mealtime behaviors. The more elements that you can keep consistent during meals, the smoother that learning process can become. The routine before, during, and after meals can help prepare and encourage your child for the experience, such as washing their hands and setting the table before the meal, and then clearing their plate, table, or wiping off the table after meals. For younger children, washing off the table and sweeping can be a fun task. If not, you can make it into a game. For example, create a circle on the floor with tape and have the child try to sweep all the crumbs into the circle to get a bullseye. Or when washing the table, race to see who can get the dirtiest rag, or turn on some music and have a freeze dance and have the child dance and clean until you pause the music. Repeat as many times as needed until everything is clean. It's also important to establish a pleasant and enjoyable environment around meals. Research shows that if the child learns or experiences negative or unpleasant emotions with food or during mealtimes, that their appetite can actually be physically suppressed or turned off. So it's important to avoid punishment during meals and to provide positive reinforcements such as verbal praise, a smile, a touch, or cheering. Try to avoid using food as a reinforcement or as a bribe. Remember, children observe and imitate their parents' attitudes towards foods, portion sizes, and dietary preferences. So try to be mindful of your own mealtime behaviors. Children also learn how to eat, bite, and chew by watching others, as we can't see this unless we look into a mirror. Additionally, get everyone involved. Have the children help out preparing the food, and it can be as easy as washing the fruits and vegetables and setting the table. For older kids, allow them to help pick out the recipes and help prepare it. Try to give your child choices and a sense of control, which can be both rewarding and regulating. Allow your child to decline a food in a positive way, such as by offering a no thank you dish in which they move the food that they do not want onto the dish. Also try to limit distractions, such as turning off the TV and setting aside the phones, turning your child's chair so they face less visual distractions, and then removing toys from the table, which can help your child focus on the goal of eating. It's also important to match food to your child's skill levels, so provide foods which are developmentally appropriate in the proper texture, portion size that are all appropriate to the child's needs. It's really important to expose your child to non-preferred food options daily. So give your child a choice between two foods that are not preferred rather than selecting for them. To prevent your child from food repetition and burnout from the foods that they do like, try not to serve the exact same food more than once each day. And it's also really important to provide repeated exposures to new food. You can also gently change preferred foods to keep them new, such as if they like plain pancakes one day, try blueberry the next. For children in foster care, sometimes the trauma of transitioning from different homes can reduce appetite, so they'll allow them to eat favorite and familiar foods and gradually add one new food item per meal. You can also try adding foods that are similar in taste, texture, or color to the foods that they do prefer. For example, if they like pancakes, try banana pancakes. If they like macaroni and cheese, try butternut squash mac and cheese. If they like grilled cheese sandwiches, try quesadillas with melted cheese. And then there you can also introduce a small amount of mild veggies. If sweet potato is an accepted food, try introducing pumpkin, carrot, or squash. Vegetables are great because they can be prepared in many ways to mimic the characteristics of already accepted food items. So try serving your vegetables mashed, boiled, diced, baked, or even raw. Another strategy is to try serving unfamiliar foods or flavors young children tend to dislike at first, such as sour and bitter, with familiar foods that kids tend to prefer, like sweet and salty. So you can try to pair broccoli with grated or melted cheese. Like I said before, eating is one of the most complicated sensory tasks that children can participate in. Research indicates that in children who have undergone traumatic experiences, 18.9% may develop heightened sensitivities to taste and smell. Trauma, especially when experienced at a young age, can deeply influence a child's sensory processing and integration. The brain's response to traumatic events can result in heightened or impaired awareness or sensitivity to sensory stimuli, including taste and smell. Taste and smell sensitivities can influence a child's eating habits, which can cause aversions to certain foods or textures. They may struggle with trying new foods or eating a variety of foods due to their heightened sensory responses. If you remember from the interoception module, children with trauma may have either hyper or hyposensitivity of internal sensations. For example, individuals with hypersensitivity to taste and flavors may experience strong, overpowering sensations from even mildly spicy or strongly flavored foods. They often gag when new textures are introduced. This has been associated with higher levels of food refusal or picky eating, and then eating a smaller range of food, including fruits and vegetables. Individuals may also have hyposensitivity to taste and smell, which can lead to strong preference for more strongly flavored foods, such as spicy or minty, and then can lead to a disinterest in eating. And your child may experience decreased sensations of hunger and fullness that also affect food intake. Hyposensitivity can result in decreased awareness of food in or around the mouth and can lead to overstuffing their mouth or limit their food preferences. It may also impact oral motor ability to use the tongue and lips effectively. Children with hyposensitivity often struggle with postural control and gross and fine motor abilities. This affects a child's ability to sit upright at the table and managing utensils to scoop or stab food to bring to mouth. Certain tastes or smells may be linked to the traumatic history, acting as triggers that bring back memories or emotions associated with the trauma. This association can further intensify their reactions, so it's important to be mindful of your child's past when incorporating new foods and experiences into their daily routines. Visual and auditory sensitivities can also trigger mealtime challenges, including bright lights, overcrowded plates, and loud noises in the dining environment, which all may affect the ability to focus on eating. Children with tactile or touch sensitivities may also have a difficult time using their hands to feed themselves. Here are some sensory processing challenges that you might encounter. By recognizing some of these signs, you may be better prepared to plan for avoidance or dysregulated behaviors. Some examples of hypersensitivities include hearing, visual, taste and smell, and touch and movement. So some of these examples include being easily startled by noise or feeling anxious in anticipation of loud noises, such as before the school bell rings or before you flush the toilet. They also can be sensitive to bright lights or easily distracted by visual stimuli. Your child may also dislike strong tastes and prefer bland tastes. They may be prone to gagging or having strong reactions to new smells. They might have a strong preference for either enjoying hugs or disliking hugs. They may be overly sensitive to the textures on their clothing, and will have a strong preference for or against messy play. So they may avoid touching food completely or may enjoy it a little too much. In addition, for movement, they may dislike spinning and jumping and avoid activities that involve their feet off the ground. Often these kids can be on the go and seeking lots of movement, like jumping on and off things. So examples of hyposensitivities include enjoying loud noises or liking bright lights. They may eat non-food items or enjoy hard and crunchy foods. And they may love strong tastes like spicy or minty. It may take firm touch to respond to the stimulus, or they may have difficulty responding to pain or temperature. They're typically always on the go, have trouble sitting still, or they can be quite lethargic and need more input to be aroused. Here are some calming strategies for dysregulation or when the sensory experiences become too overwhelming. If you haven't watched the module on interoception, I recommend listening to that. I talk about self-regulation strategies more in depth, but an important thing to remember is that if your child is in a state of dysregulation or they are having a meltdown, it is too late to tell them to use a calming strategy. So instead, it's more appropriate to model the calm down strategy together. For example, sitting down and listening to music together, or reading a book, or going for a walk. So some strategies can be applying deep pressure, such as wearing a weighted vest, asking for a bear hug, lying under a heavy blanket. You can also try deep breathing exercises. For younger kids, you can try blowing bubbles, blowing paper, blowing pinwheels. You can adjust the environment, such as dimming or turning off the lights. Animal walks are also a great activity to do. I've provided a few examples on the next page. Really, there's a lot of different things that you can try. It's up to you and your child to figure out what works for you. I have provided a list up here with quite a few ideas that you guys can go through together. So here are some of those animal walk ideas. You can walk like a frog or hop like a frog. You can do bear walks, crab walks, caterpillar walks, or kangaroo walks. I've provided the links for these down here if you want to look at that image more closely, or you can Google animal walk ideas. And just be creative with it too. Have your child name an animal and you guys try to figure out what walk they would do. Children learn best through play. Young children under 6 to 10 years old spend a significant amount of time engaged in play and fantasy and exploring and understanding the world through imaginative and pretend play. Typical reasoning isn't as effective in this age and is more useful for kids 10 years and older. For example, explaining to your child that eating a variety of fruits, vegetables, and proteins is important for the bodies to stay healthy and strong is really abstract, and they are less likely to grasp that concept. Instead, try to make it fun and imaginary by creating a playful story. For example, pretend eating various foods will give your child superpowers, and let your child pick which superpower the food provides. For example, eating carrots will give you supervision and strength. Or you can provide a variety of color foods to meals and try to eat the rainbow together. You can also pretend each color provides a special power. Be as creative as you want here. It's even more important to be fun and engaging when working on overcoming sensory sensitivities. Play allows children to explore and engage with various sensory stimuli such as touch, movement, sound, and visual input. Through play, they can learn to process these sensory inputs, and this will help them regulate their responses and develop appropriate reactions. For example, playing with different textures like sand, water, grass, and Play-Doh can help your child gradually become more comfortable with sensory experiences and can aid in improved tolerance over time. For children who get very distracted by certain sensory information, try to reduce that sensation. For example, if your child gets overwhelmed by sounds, offer noise-canceling headphones. If your child gets overwhelmed by light, try dimming the lights. You can slowly try to introduce these sensory experiences when your child is ready. If your child doesn't like getting their hands messy, provide multiple opportunities to play with various textures and slowly grade up the challenges. So you can start playing in dry beans and rice and then move to sand and then shaving cream. Your child needs to be exposed to the various textures many times before they can be expected to interact with it. So it's important to be involved in the activity with them. If your child has high sensitivity to sensations, try increasing that sensation. For example, a child with hyposensitivity may not feel bodily sensations from general movement, like walking and playing as strongly as other children might. So to try to provide various opportunities to intensify these movements, like running, sliding, jumping, crawling, doing animal walks in safe environments to let them better perceive and process these sensations. These sensations can also help a child calm their body and feel more oriented in space. They're also great to improve postural control, which is important for sitting and being stable at the table. As I mentioned before, the sensory properties of food are constantly changing from one presentation to the next and during chewing and swallowing, so it's important to use food to help build sensory skills. However, toys, objects, and tools have their place. Some sensory strategies to help facilitate mealtime success include engaging your child in vestibular and proprioceptive activities prior to mealtime. This includes jumping, running, swinging, rocking in a chair, pushing or pulling a heavy object, and bouncing on a ball, which all can aid in calming and self-regulation of their body and can decrease stress and anxiety and increase their attention and their focus. You can also alter the environment, such as dim the lighting, reduce sounds, such as turning off the TV, alter their seat to support proper positioning in the chair, or add a weighted lap cover or footrest, which can help increase their focus on the meal. You can change the plate or the utensil if the child has aversions to those. During mealtime, only make one change to the food, such as through the texture, the taste, the size, or the smell, and then gradually increase the changes over time, but it's important to start slow. Frequently offer new kinds of foods. Children often need multiple exposures, like 10 to 15 times to a new food before they can be expected to try it or put it in their mouth. Ask the child to observe the food by looking at it, touching it, smelling it, without the expectation that they have to eat it. Expose challenging foods through daily routines, such as having them help clear plates from the table and by helping prepare the food or setting the table. You can also provide a no thank you dish where they can remove the food from their plate to a different designated spot. When trying new foods, allow your child to spit in an appropriate spot, such as in a napkin or a specific bowl. If your child is afraid to try new foods or swallow new foods, allowing them a place to spit appropriately without being forced to swallow will help them take more risks when trying food. Hypersensitivity strategies should focus on gradual exposure and repetitive experiences to develop tolerance and skills. This is beneficial for children who are easily overstimulated by sensory inputs because they can gradually explore food without the added pressure of eating it. Children with hypersensitivity often gag when trying new food, so it's important for you as caregivers not to overreact with fear and panic, as this can teach your child to be fearful of it. It's also common for parents or caregivers to end a meal when their child gags, and your child may learn that gagging means they can be finished. So if that happens, try to encourage at least one more bite. It's also important to reassure them that if they do gag, to say something along the lines of, "You're okay," or "That was a big bite," or "That was a new flavor." For each meal, try adding one new food or texture each time alongside a preferred and familiar food, even if you don't like that preferred food. If your child rejects a food, don't assume that they don't like it. Some children need to become familiar with the new food before they accept it. Remember, it takes approximately 10 to 15 exposures of a food before a child may begin to accept it. Another strategy is to change the format of their preferred food so they can explore new textures and shapes while still enjoying the same flavors. For example, a grilled cheese sandwich, you can cut the grilled cheese into stick-shaped pieces, into bite-sized pieces, or fun shapes with cookie cutters. Or you can try to create a grilled cheese roll-up. Any sensory-based strategy should be fun and playful, so allow your child to play with their food and get messy. Wait until the end of the meal to clean them up. If you have a younger child and don't want to have to worry about doing extra loads of laundry, I've attached a link here which offers some protective clothing options. And if playing with food during mealtime becomes a problem, set up a specific time outside of mealtime for food exploration. Here are some play-based strategies if you notice your child has any hypersensitivities. So, for example, if your child has touch sensitivities, you can create a sensory painting activity using various foods such as sauces, whipped cream, pudding, yogurt, or sprayed cheese. Allow your child to use their fingers to paint and explore these textures. You can also expand upon this and have them lick their fingers to work on taste hypersensitivity as well. If your child has vision sensitivity, try to create a themed approach to sensory exploration, such as creating an underwater scene using blue gelatin. Or you can set up a sorting activity where your child groups foods of the same color into different bowls, such as using M&Ms or similar colored fruits like strawberries or raspberries. If your child has sound hypersensitivities, use a pretzel rod or create craft shakers using beans, dry cereals, or crackers, and allow them to create different sounds and rhythms and explore auditory sensations while also engaging in a playful activity. If your child has smell sensitivity, try to encourage them to participate in a guessing game by sniffing different foods with their eyes closed, trying to identify what food it is based strictly on its scent. Another great strategy is to use pretend play, such as using a banana as a telephone, feeding your doll with pretend food, or filling a dump truck with cereals or beans. These activities foster imagination and creativity while also exploring the sensory aspects of touch and smell and taste. For children with hyposensitivity, they often have decreased sensitivity or diminished responses to sensory input. So strategies should aim to help the child achieve optimal arousal to prepare the child for the meal. Some arousal strategies include having your child wash their face and engage in a series of facial movements and stretches, such as acting out animal faces, making silly faces in a mirror, blowing bubbles, or filling their cheeks with air and holding it for a few seconds. Activities like these can help bring awareness to the mouth. You can also use deep pressure in the mouth, which can have a calming effect on behaviors. So try using a baby toothbrush to provide pressure to the roof of the mouth. If you're worried about your child sticking an object too far in their mouth, they make mouth guards for toothbrushes or straws. You can also try a vibrating toothbrush to reduce hypersensitivity in their mouth. To arouse the entire body, try a series of gross motor activities like pushing and pulling heavy objects, jumping, running, or bouncing on a ball. Children with hyposensitivity often overstuff their mouths with food due to a lack of awareness in their mouth. So for this, you can try having them eat in front of a mirror, looking in their mirror to clean their face, or looking in the mirror to see if they have finished chewing. Another strategy is to alternate bites of different foods to change the texture and taste to bring awareness into their mouth, such as switching between smooth textures of yogurt with crunchy textures of cereal. You can also provide small portions on their plate and offer more servings as needed to prevent overstuffing. You can try pacing activities, such as using a utensil if your child tries to eat handfuls. You can also use a visual mealtime timer, such as the FIST food ingestion timer, slow eats, 20-minute eating, eating slower, 80 bites, or time your bites. All of these can be found on the App Store. Lastly, you can use a drink to help clear their mouth between bites. Specific food items can have a calming or alerting effect on behavior. So the way the food feels, tastes, or even sounds as we eat it contribute to our sensory experiences. This includes like textures such as chewy or crunchy, temperature such as hot or cold, and different flavors like spicy, sweet, or sour. Chewy food can help organize and calm the sensory system, such as eating cheese, cereal bars, dried fruit, or chewing gum if your child is at least 5 or older. Crunchy foods can encourage biting, and crunching can help alert the mouth and increase the child's arousal levels, improving attention and focus to different sensations. You can use foods such as raw vegetables, apples, breadsticks, or popcorn. Cold items can also help alert the mouth and bring awareness to how the mouth feels, so using ice cream, popsicles, or frozen grapes. Other strategies that do not involve actively eating can help bring awareness to the muscles in the mouth. Some strategies include sucking, like using a straw to drink thickened foods like yogurt, smoothies, or milkshakes. Blowing, like blowing bubbles into their cup or bowl using a straw, or using a straw to blow pom-poms, feathers, marbles, or cotton balls across the table. It's important to use descriptive language when a child is exploring new foods, such as describing the colors, the sounds, and textures of that food. For example, you can say, is it hard or soft, or is it smooth or bumpy? What sound would it make when you bite it? Is it squishing or crunchy? What does it taste like? Is it sweet or is it sour? It's better to use this kind of language rather than just yucky or yummy, as this kind of helps the child know what to expect and associate how that food would feel in their mouth before they even taste it. Children in foster care often come from challenging backgrounds, which can include neglect, abuse, malnutrition, or lack of appropriate developmental stimulation. These early experiences can impact their oral motor skill development. Some foster children may not have received adequate early intervention services to address delays in oral motor and feeding skills. Oral motor challenges can include difficulty with strength, coordination, control, or endurance of the lips, tongue, cheeks, or jaw muscles. And it can make it difficult to effectively bite and break through foods, manipulate food from side to side in their mouth, chew and swallow effectively, or maintain liquid in their mouth. Young children often enter foster care with weak oral motor skills due to early weaning, inappropriate nipple for bottle feeding, or limited or lack of introduction to solid foods, which can all lead to difficulty chewing and swallowing age-appropriate textures. Children who have had limited oral sensory experiences often have oral hypersensitivity and may have a strong gag reflex. Some signs of impaired oral motor skills to look out for include difficulty with feeding and eating, which may be difficulty coordinating movements, frequent gagging, choking, or coughing, or overstuffing their mouth. Also look out for fatigue when eating, such as difficulty or tiring easily from chewing. If they have limited oral movement, such as limited range of the tongue, lips, and jaw, which affects the ability to make various oral movements required for speech and eating. If you notice a frequent open mouth posture followed by drooling or limited tongue movements. If you notice they have hyper or hyposensitivity in the mouth, which can lead to aversions or heightened sensitivities to certain textures, temperatures, or tastes. If your child is refusing to eat or has frequent mealtime tantrums, or if you notice weak jaw muscles or a lack of lip closure. So if their food is frequently falling out of their mouth, or if they have difficulty closing their lips during activities such as drinking from a straw, blowing, or pursing the lips. If you have any concerns about your child's ability to eat, please see your primary care physician to rule out any underlying medical conditions. In addition, a feeding specialist can help provide specific strategies for your child's needs. For children who have restricted food choices and weak oral motor skills, start with preferred food choices that your child can easily chew without getting fatigued. Gradually increase the difficulty. For example, if your child likes and can safely eat cooked pasta, try cooking it a little less so it's a little firmer to increase the challenge. Practice oral motor skills at snack time and in between meals to prevent fatigue during meals. I've provided some examples here, but if you would like some more examples, you can click this link here. I also provided a video and a handout on the use of chewy tubes for oral motor strengthening. I recommend that you seek advice from your child's occupational therapist for more specific strategies in using these tools. Before mealtime, make sure your child is seated properly in an upright position in their chair with their hips, knees, and ankles all in 90 degrees, and you can place their feet on a footrest, a box, or a stack of books, whatever you have. You can also place a folded towel or blanket behind the child's back for more additional support. The utensils that you use can also play an important role in feeding success. You can use a suction bowl or plate to help keep your dinnerware in place, which can reduce spills and messes, and also make it easier for your child to feed themselves independently. If you notice your child has decreased lip closure, you can try using a spoon with a shallow bowl, or you can use a spoon with shorter, curved, or larger grip handles, which can help them be more independent. You can use spoons with ridges or chill your spoons to offer more sensory input for children who may have hyposensitivity. This can help bring more attention into their mouth. Children with weak oral motor skills often overstuff food into their mouth to compensate. When the mouth is stuffed with food, they don't need to work as hard to use their tongue to push food from side to side in their mouth or to push the food to the back of their mouth for swallowing. Some strategies to help prevent overstuffing include choosing appropriate foods for your child's oral motor skills. So you can offer single pieces of food at a time, limit food with lots of pieces, such as rice, which can be hard for your child to control. You can cut foods into small, soft cubes or long sticks. You can also present food on a cocktail fork, which can help get the food back onto the molars. You can use food choppers to help pre-chew foods to reduce the amount of chewing required. Children who overstuff may have hyposensitivity and may not be aware of how much food is in their mouth. So you can try increasing sensory input from the food, such as adding spices, sauces, or chilling the food to make it cold. You can also try stronger tastes like spicy or sour or very crunchy foods like crackers. If your child overstuffs their mouth, it may lead to them spitting food out when their mouth becomes too full, which can lead to gagging or vomiting. Weakness in the mouth can also lead to increased drooling and dropping food out of the mouth. So provide easier to manage foods, such as those with a softer texture, and provide smaller pieces. Slowly offer foods that can be eaten safely, but provide more of a challenge. And practice oral motor skills between snacks and between meal times. Frequent and consistent coughing on food and liquids puts your child at risk for aspiration, which is when food, liquids, saliva, or vomit is breathed into the airways. If you are noticing consistent or frequent coughing, gagging if your child is over 15 months of age, or vomiting during eating and drinking, or if you also notice wet breath sounds or wet voice quality when eating and drinking, I recommend you see your primary care physician, who may then refer you to a swallow study for your child. In the meantime, you can offer soft, solid foods that are easy to break down. And if your child coughs when drinking from an open cup, provide a sippy cup or use a straw. It's important to note that if your child can cough, they can breathe and they are not choking. Choking is silence. So if you notice your child is unable to cough, unable to breathe, cry, or speak, or if their skin is turning pale or blue tinted, call 911. If you also notice that your child is struggling with prolonged mealtime, so meals lasting over 30 to 45 minutes, try to offer them more challenging foods, such as crunchy and chewy foods at the beginning of the meal or at snack time to prevent fatigue. If you have any concerns with your child's ability to eat, sensory needs, or mealtime behaviors, I recommend getting in to see an occupational therapist. An OT can help provide interventions and activities to address your child's specific needs, such as creating a sensory schedule, facilitating proper positioning during mealtime. They can help facilitate gross and fine motor skills and ideas to manage mealtime behaviors, specific oral motor strategies, and they may recommend certain adaptive equipment, such as adaptive utensils, which all can aid in mealtime success. In the next module, I'll go more into depth on certain behaviors such as stealing or hoarding food, throwing tantrums at the table, overeating, undereating, and more. I'll provide strategies to try and overcome these issues to use as a placeholder until you can get your child in to see an OT or other healthcare professionals. Here are some resources that may be helpful for you. Thanks for following along. If you have a few minutes, I would really encourage you to go either scan the QR code or go to the main module page. There's the link there that will take you to the survey. But your input as parents is invaluable in guiding the development of my research project, and your feedback will play a significant role in enhancing this education program. So I'd appreciate if you took a few minutes to complete this survey. Thanks again for watching. I hope you found some of the information useful. Module 4 will be uploaded to the website in about 1 to 2 weeks.